seasonality implies that indeed we have some information about how this virus will behave over years and over many, many months. And most people think, when they hear seasonality, they think influenza. And they think, Northern Hemisphere winter season, Southern Hemisphere winter season, and it may get bad. We are 5 months into this pandemic. We have 5 months worth of data on COVID-19. We do have some experience with SARS, we do have some experience with MERS, we do have some experience with other human coronaviruses, but there is nothing right now to indicate that this virus will resurge in winter months. What we know is that from the seroepidemiology studies is that many people remain susceptible. And that means if the virus is there, regardless of the temperature, regardless of the month, that virus can infect people. And if people are in close contact with one another, it can resurge. The complication becomes, if we think of waves, if we think of winter months, if we think of flu, is when we have co-infection or co-circulation of influenza and COVID-19, as we are seeing in the Southern Hemisphere, that could complicate our understanding, because if we don't have testing in place, we don't know what people are infected with. And so it could potentially flood the system. It could potentially overwhelm the system. But specifically to your question about waves and about seasonality, we don't have enough information right now to know how this virus will behave over many years. What we know and what we need to prepare for is that the virus can resurge if we give it an opportunity. We don't need the winter months to be able to do that in the Northern Hemisphere. We are seeing increases in a number of countries, and as I've said previously, all countries need to remain on high alert in terms of their ability to detect cases and have this comprehensive package and this approach of finding, isolating, testing, caring for cases, tracing contacts, quarantining those contacts, caring for individuals, empowering the population, making sure that we have all of our public health infrastructure in place to deal with COVID-19 and deal with all of the other diseases that are affecting our countries.
And if I could just add, John, that's why I used the word second peak, because we would tend to talk about waves of infection in terms of the natural history of a disease in the absence of control measures, the natural phenomenon of waves of disease, which maybe reflect seasonality, they may reflect the population behaviour during different seasons, the amount to which people mix or are indoors. So there are factors that may drive the natural transmission dynamics during different seasons. It's not that the season itself, the temperature may affect the disease, but in many cases it's not necessarily the temperature. It may be the fact that in wintertime people are indoors more, they're in much more contact with each other. So there are the natural phenomenon. I think many countries have paid a heavy price in doing the measures that have needed to be done to suppress the transmission of this disease, and they deserve credit, and the communities deserve credit for the efforts and the sacrifices they've made to break chains of transmission. And that has driven down and suppressed virus transmission. It would be, I think, at this point, a little bit worrisome if people assume that the downward trend in disease has occurred naturally. I don't think any of us believe that that has occurred naturally. That has occurred because of very, very, very tough public health measures that have been tough on the population. And if we assume that, if we take that to be true, if we take the fact that we've pressured the virus, we've pressured transmission and we've driven transmission down, then the corollary, the opposite, is true, that if we take the pressure off the virus, then the virus can bounce back. And that's where we are right now. If we can, what's happened in many countries is that countries that have managed to keep transmission low or have managed to suppress transmission down to a low level have then found it relatively straightforward to contain the disease after that. They found a level of disease at which their public health system, their testing, their tracing, their contact tracing, their isolation, their quarantine, their healthcare system can maintain a status quo. It reaches a steady state. And we hope we can retain and maintain low levels or no transmission over time. And then we'll see what happens with the second wave concept later on. And that may still be an issue. My concern right now is that people may be assuming that the current drop in infections represents a natural seasonality. And I think that's a dangerous assumption. I think a huge effort has been made to suppress transmission of this virus. And to remove pressure from the virus at this point, making an assumption that it's on a downward trajectory and the real next danger point is sometime in October or November, I think that would be a dangerous assumption. I think this virus is under pressure because communities, public health authorities around the world are putting the virus under pressure by reducing the opportunity for the virus to transmit. If we give too much of an opportunity back to the virus to transmit, as the DG said, if we let the virus get ahead of us again, and we don't have the systems in place to be faster than the virus, the danger is we could rapidly get back to a second peak, and in fact, maybe just experiencing the first step on an ever-increasing trend.
Thank you, Dr. Ryan. We've gone well over the hour, so we're giving the last question to Nina at AFP. Nina, are you on the line? Please go ahead.
Yes, hi, can you hear me?
Very well, please go ahead.
Okay, well, thank you. Thank you very much for taking my question. So I had a question on China's foreign minister, who yesterday said that the country was open to international cooperation on identifying the source of the novel coronavirus, and suggested that WHO probably should lead that investigation. I was just wondering, has the WHO now been invited to China to take part in such a probe? And if so, when would you expect such an investigation to start? Thank you very much.
Maria may wish to add. We've been in discussions day to day with our colleagues in China about putting together the necessary scientific inquiries into the origin of the virus. I think the authorities in China, governments around the world and ourselves are very keen to understand the animal origin of the virus itself. And I'm very pleased to hear a very consistent message coming from China, which is one of openness to such an approach. And again, pleased that we've seen, for example, the publication of the first peer-reviewed journal publications of the vaccine studies from China. And again, I think in terms of the number of scientific publications that have come from China over the last number of months is very good, and the number of scientific collaborations between Chinese institutions and institutions all over the world is also a very positive sign. So I think we will be very pleased to continue those discussions. I don't believe, Maria, there's a date yet for a scientific mission, but we will be looking forward to doing that as soon as possible, and with the right mix of scientific experts from a multinational perspective to join such a team.
Yes, only to add that, yes, we have been in regular contact with our colleagues in China, and they have all the expertise in country to be able to do this. We welcome the opportunity to work with them and with the international community to really understand the virus origins and the animal-human interface because of the public health importance of this. SARS-CoV-2 virus, that causes COVID-19, is a zoonotic pathogen. And it's important for us to understand the intermediary host of this particular virus so that we can work towards preventing something like this happening again. As we all know, as you all know now, most of these emerging pathogens do come from animals. So it's important that we have a strong system in place, and we're working with our partners at FAO and OIE, our sister agencies, to be able to work towards surveillance in animals and at the animal-human interface. So we welcome this opportunity to go forward. But I do want to make one other point from the last question, and I don't know if DG would like to comment on this as well, is the idea of complacency. One of the things I've been asked recently of what worries me the most, and it is complacency, and it relates to the last question in terms of what our expectations are of this and waves and what might happen. We here at WHO and with our regional offices and country offices are planning for any scenarios. There's a certain predictability of this virus, but anytime you become complacent and you think you know, it will surprise you. And this virus has an opportunity, and it will take advantage, every advantage that it can, to resurge, to transmit. And so I understand very well, and I am in the same boat as you. We all want this to be over, but we have a long way to go. We're at the beginning of this, and we must continue to really stay strong. and not become complacent. And I know that that is very hard. So it's something that we are conscious of, and we are ensuring that we are working with you, to support you through this. But it is important that we don't become complacent.
Thank you. I would like to add to the first one. As you know, with China, we have agreed on two issues, and the study of the origin of the virus is not actually new. We have agreed on having international experts to visit the country, which was done in February. And this was also agreed during that time on the origins also. So it has been there on the table. It's a matter of continuing and doing it. But all stakeholders understand the importance of studying the origin, because it's by studying the origin that we can prevent it from happening in the future. So this is not a new thing, as Mike and Maria said, something that has been already going on. The discussion has been going on, and something that there was already agreement. Thank you.
Margaret, just before you finish, I know the DG has very much recognized our colleagues on the African continent, but just from a personal perspective, to say thank you to Chidi and our team in Afro, to John and his teams in Addis Ababa. These teams have not only been fighting COVID, but have been 500% committed to so many epidemics in Africa, and particularly the Ebola outbreak in Congo, DR Congo, over the last year and a half. I think African clinicians, epidemiologists, nurses, public health physicians, so many others in Africa have sacrificed so much over the years to protect populations in Africa, but also populations around the world. And they've done that with limited resources, with limited investment, but with huge professionalism, huge courage. I just wanted to, on this Africa Day, just say thank you from the world to our African colleagues for all they do to protect the world from emerging and infectious diseases.
And I'd also like to ask Dr. Moeti if she's got any closing remarks.